Hello, this is Donna Smith again. About to complete the week 5 lower extremity video, hoping to keep this much more succinct since I completely overshot it the last time. We'll be working with the case for the police officer who was in an on-the-job accident with a goal of getting her back to full duty in 3 months. Femoral joint, longitudinal movement in the caudate direction. Close, stabilizing the pelvis with my body, my axilla. 1, just thinking about it. And then grade 2, large amplitude for pain modulation. And as we progress, I could move into grade 3 and 4 to address capsular tightness. Femoral joint, lateral movement, going to start out with grades 1 and 2 and move into 3 and 4. First addressing pain modulation after a femur fracture, and then transitioning as I would in the later weeks into 3 and 4 to address stiffness. So for 1 and 2, I would have prepared the patient for where my hands are going to go. I'm close to the joint as I can get with my palm under there, thumbs on top, stabilizing the leg. 1, just thinking about it. 2, large amplitude, no resistance. How's that? Good. We'll quickly have the patient transition into supine. I'll do lateral movement showing grade 3 and 4. I'm going to use this again. I would use a bigger one just because we know she has a restriction in range, which I wouldn't be able to control as well. And I'm going to get down close to the joint as I can, interlacing my fingers comfortably. How's that feel? Yeah. And then 1, 2, getting into grade 3, into resistance, large amplitude, and then 4, really using my trunk and arms. Okay. Femoral joint, have her back in a little bit of extension. This is to address with grades 3 and 4 through a posterior anterior mobilization of the femoral head to address stiffness, trying to regain more extension and abduction and internal rotation as she's limited in. So later on in the course of treatment, I'm going to get over the head of the femur. I'm going to stabilize the front of the pelvis using my body, my arm, then move into grade 3, larger amplitude, and right at the end of available range with resistance, grade 4. How's that feel?
Okay.
Hand pressure?
Good.
This is medial rotation of the femoral joint with the patient in prone. And I'm going to support her. She's limited. Initially, she was limited by around 50% from normal. I'm going to grasp her heel comfortably, 4 foot. Bring her out, support her, stop at my leg. And then I'm going to use grade 3 and 4, addressing stiffness, trying to get more range. She's not having any pain. 3, and then 4. You can invert the foot to get a better, oh, that is a lot better. And then back to 4 again, small amplitude. Working on the knee mobilizations now. Going to be doing a posterior anterior accessory movement, grades 3 and 4, to regain knee flexion due to stiffness of the joint after immobilization. Have the distal leg cupped with this hand. I'm going to be facing the patient. Bring my arm around so I can get my hand on the tibia, moving on the femur. I'm going to provide a grade 3 after I move through the other grades initially. I'm going to get into grade 3, large amplitude. I can even provide some flexion force at the hand on the distal part of the leg. Grade 4, small amplitude. Does that feel? Okay, I'm going to run through grades 1 through 4, starting out with grades 1 and 2 for anterior-posterior movement of the tibia on the femur. And come over the tibial tuberosity, my hands comfortably behind, just thinking about it initially. And then for pain modulation, okay? Mm-hmm. Okay. I'm using my arms and my body to large amplitude, grade 2 mobilizations without resistance. Yep. Then move into 3 and 4. We will just keep this. Alright, get up in this position and rest your leg in about 70 degrees of flexion. She definitely has that. You could go even further. And at this point, I will there we go. Had to remember my hand position. Okay, and then I'm going to go through to grade 3, large amplitude into resistance. Grip okay? Everything feel okay? And then grade 4, really using my body even more. Small amplitude into resistance. Okay. Lastly, patellofemoral glides, because the patient is lacking inferior medial movement, and so a position of patella alta, lateral position. So I'm going to use, I really liked the way that the instructor did it on the videos for ATSU, and I found for me also, I used to do this a lot, but I really like this kind of cupped position. Use my arms and my body, and I'll move into that inferior. I can start with, even with grade 1, just thinking about it, then grade 2, large amplitude beginning, grade 3, large amplitude moving into resistance, and I can use my hands to really find specific little zones of restriction. And then, so this is large amplitude, grade 3 into resistance. Kind of even moving a little bit right there, and then grade 4. And then I can even, if need be, kind of slowly back out, back into those larger amplitude. Grade 3 with resistance. Back out into grade 2 without resistance. Play around again, trying to find any other little areas where there's pain or stiffness. Alright. This is talocural joint. I'm going to do 2 mobilizations in this one taping. So I'm going to start out with the patient in plantar flexion, but she's limited in that and dorsiflexion and eversion. So I'm going to come down along the talocural joint, an anterior posterior motion. There won't be a whole lot of movement, but I'll use the force of my arms here. 2, and into 3, larger amplitude into resistance. Definitely not as much motion as in some other mobilizations. How's that feeling?
Okay.
And then I'm going to go to 4, which is going to be heavy into the resistance. Very little movement. Okay, and then move into dorsiflexion. So more mindful of what she has and doesn't have at knee flexion. Limited at the dorsiflexion as well. It's much tighter trying to get in here. But keep my fingers alongside. Again, using my arms parallel to each other. So 1, just thinking about it. 2, how's that feel?
Okay.
Okay. Large amplitude. And then 3, large amplitude into resistance. Could probably even have the patient use their weight bearing force to come forward into more dorsiflexion is tolerated. And grade 4. Very little movement. Okay.
Okay.
Last ankle mobilization. I'm going to do a transverse movement in the medial direction. Moving the talus and the calcaneus on the lower leg. Is that comfortable?
Mm-hmm.
Okay. I'm going to start out with grade 1, just thinking about it. 2, large, well, relatively speaking for this articulation, larger amplitude without resistance. Grade 3, I can feel that difference. Is that good? Larger amplitude, grade 3. Really getting my body and arm up over it. And then in grade 4, just a little bit of movement. And back to 3. And I can even change position in terms of dorsiflexion and plantar flexion.